So what has the research been telling us about medication use to reduce relapse risk for opioid use disorder? Well, we know that achieving long-term recovery can be hard. There was a study recently that showed that as many as 91% of people will eventually relapse back to daily use, even after completing a medically managed withdrawal. So the numbers here are not wonderful. We've had these treatment options for a little while now. There's some mixed opinion on their overall long-term place in treatment, but their ability to reduce the risk of relapse or overdose in the immediate months after discontinuation is pretty well accepted. So a study was done recently that compared buprenorphine to a long-acting injectable naltrexone product, Vivitrol in this example. So they took 100 people, followed them for 12 weeks with a primary outcome of reducing relapse risk. Relapse in this case was defined as 4 weeks of at least 1 or more day of opioid use or 7 consecutive days of opioid use. And what they found was that the injectable naltrexone, so the Vivitrol, was associated with a greater reduction in the risk of opioid relapse relative to buprenorphine, which might be a little bit surprising. Now, it's important to keep in mind that although injectable naltrexone might be as good or even better than buprenorphine for some, buprenorphine may still likely be a better option to prevent overdose for those who tend to be more ambivalent, right, towards abstaining from opioid use entirely. So interesting study, but certainly more research is needed to know which medications are the safest, the most effective, and for which people, and in which outcomes of interest.